Good morning, Chris Kelly here with EFT Tapping Solutions. Today the topic is massage therapy and EFT tapping. I spend most of my days working both with EFT tapping clients and with massage therapy clients. They work hand in hand. It's a great protocol, and obviously I'm going to be demonstrating some tapping on the physical body and physical pain. So this isn't something that you can do or we can do over Skype. That's one reason I'm creating these videos, is to get more business on the internet and to do tapping on your iPhone or through Skype. But if we're going to do massage therapy, you have to be here in person. So if you're here in the Las Vegas Valley, if you're in Henderson, North Las Vegas, Boulder City, Clark County, we can do this in person. If not, you need to find a massage therapist who also does EFT tapping. So let's begin. I think, like I said before, massage therapy and EFT tapping work great together, okay? This is true mind-body coordination or connection, okay? We're working both the mind and the body. And although EFT tapping does relax the central nervous system, I don't have my hands on you at all, or if I'm possibly helping you with the tapping points, that's fine. But as you know, massage therapy is more of a hands-on technique or practice. So the first thing we need to do is with massage therapy is we go over your client intake form and we go through your medical history, okay? We need to make sure you don't have any serious disorders or diseases such as, diabetes, multiple sclerosis, Parkinson's disease, cancer, some of the more serious issues, whether you have them now or if you've had some of these in the past. A lot of these I need to have your doctor's approval before we can proceed. So assuming that we can, what I'm going to do is kind of walk you through this a little bit. I have a lot of clients that receive massage therapy, and then once they find out what EFT tapping is, then we move into performing EFT tapping and massage therapy. Let me back up just a little bit and explain to you what EFT tapping is not, okay? I have some clients that come in every week for a massage and they don't want to have anything to do with EFT tapping. And I try to explain this to them, but they just don't. And that's fine. And that's okay. But some of the myths or misconceptions that are out there in regards to EFT tapping would be that EFT tapping is psychoanalysis, which it's not, or it's some kind of mind control device to where I'm trying to control your mind and neuro-linguistic programming and, be suggestive and things like that. No, that's not NLP, and it's certainly not hypnosis, okay? I'm a big fan of hypnosis. I think it works. I'm a big fan of NLP, which is neuro-linguistic programming, and a lot of other techniques, but that's not what EFT tapping is, okay? The biggest barrier is when I talk to clients is they think anytime you start to mention the mind and psychology, people have kind of a negative connotation towards this, okay? They think we're going to have some deep session and dig up all your childhood experiences, which can happen with EFT tapping, and it's actually very successful. But this pulls people away. They shy away a little bit from this because they're thinking, well, this guy's kind of telling me I have some mental problems, and nobody wants to hear that. You kind of want to keep those to yourself and hold on to those, whether they're helping you or not. It's a little scary. So some of my clients, they just want to receive massage, and that's okay. And then other people come in just for tapping, and that's okay as well. So getting back to hypnosis, one of my clients thinks I'm going to hypnotize him, and then I'm going to erase his memories, okay? I am not erasing your memories. I'm not really doing anything to you. We're just kind of working through some emotional issues and some emotional trauma, trying to get your mind and body coordinated and to relax that anxiety and that stress, okay? So again, this is not hypnosis. I'm not erasing your memories, anything like that. We're just taking the emotional sting out of these memories. You'll still have the memories, and that's a good thing, but you just don't have that emotional burden that's dragging you down, okay? So a lot of times this will be almost like a 2-hour or at least a 90-minute EFT tapping and massage session, getting back to that. And once we get you on the table, or we'll perform some tapping first, and we'll do EFT tapping and learn the protocol. And then what we'll do is proceed to massage, okay? If you've got physical pain in a specific area, we'll work on that area with actual hands-on massage. And then if you're still not relaxed, then I can tell. I've been performing massage now for about 14 years. I can tell when you're not relaxed. And a lot of times I'll take my hands and I'll put them on your back or the part of you that's not relaxed and kind of shake you a little bit just to try and get your subconscious or your mind just to relax. And if you can't do that, then what we'll do is, even if you're face down or if you're face up, I'll hold certain parts of your body and then I'll walk you through the tapping process, and we'll just verbalize this, okay? You can't tap on the karate chop point, or possibly you could, but we don't need that with the massage therapy, okay? So what we'll do is, I'm going to use my shoulder since you can actually see my shoulder. Let's say you have rotator cuff problems, or you have frozen shoulder or thoracic outlet syndrome, or something that's keeping you from being able to abduct your arm or raise your arm up. Okay, what I'll do is we'll perform massage therapy, and we'll do a little stretching. But if it's still tight in there, what I'll do is have you verbalize the tapping, and I'll have you think about this. You know, how does this body part feel? Is it hurting you now? Okay, why is it so stiff if it's not hurting you? Okay, usually that's a mental block saying, hey, I'm afraid of the pain. I don't want to raise my arm way up here because now this is going to hurt me, and none of us want to be in pain. Okay, so what we'll do is I'll talk you through it, that even though my right shoulder doesn't want to move, or my right shoulder, I'm afraid of it hurting, I deeply and completely love and accept myself. And we'll walk through that. I accept myself completely and I love myself. I accept myself completely and I love myself. And I'll have you say this and repeat this while I'm performing the massage. And this seems to work wonders, okay? This works really well with the hands-on and the EFT tapping both at the same time. So I've had really good success with that. Another technique I use is to start with the EFT tapping first. Before we get to the end range of motion, before there's any pain or anything like that, I can tell if it's tight. And what I'll do is I'll start with you in a more relaxed manner and say, even though I can't lift my arm, I deeply and completely love and accept myself. I accept myself completely, even though I can't raise my shoulder. And then what we'll do is we'll just have you do some breathing, okay? We'll have you do some breathing exercises, some deep breathing down in your diaphragm, not the upper respiratory, secondary respiration muscles and things like that. What we'll do is just have you relax, okay? Because that's really what I'm trying to do with massage. And I think that's what all massage therapists should be doing, is getting you to relax your central nervous system, and that then relaxes the muscles, okay? And then we can work on that deeper tissue and things like that. But just relaxing, breathing, being calm, that works wonders as well. And once I can get you to relax, whether we're using breathing exercises or EFT tapping and some of the protocol, then that gets you to relax, and we get some blood flow in there, desensitize those nerves, get everything relaxed, and you're going to see much better success with your EFT tapping and your massage therapy session. So if you're face up, you're laying on your back, what we can do is then sometimes I will have you tap on the tapping points if we have a specific issue. A lot of times what I will do, if I have your permission, I always ask permission to touch people, even with massage, is I will tap for you, okay? I'll tap on these points, and I'll go around and say, even though I've been diagnosed with thoracic outlet syndrome, I deeply and completely love and accept myself. I accept myself completely, even though my shoulder hurts. And then I'll tap through all these points on you. And what I'm trying to do is I want to bring the problem or the issue to the forefront, that I can't raise my arm. And then I want you to say, I accept myself completely. I love and accept myself completely. So that's just a short video. I'm going to get a little further into the fear of pain, the fear of movement, because even though it doesn't hurt, you're not going to move your knee in full extension because I'm afraid that it's going to hurt. And a lot of us do this, and we call it bracing, or we then start to move differently, and we call that compensation. We start to compensate other parts of our body. So I'll get into that in another video in regards to massage therapy and EFT tapping. But that's enough for now. If this interests you and you live in Las Vegas, leave a comment below, and I will get back to you. Or if you're in another state or another country and this really interests you, find a massage therapist, and the one that also does EFT tapping. So that's enough for now. I'll talk to you later. Chris Kelly with EFT Tapping Solutions. Have a great day.